I asked myself, can we convert the amount of increased risk from an environmental toxin to what percent of that disease is due to that environmental toxin? So there's a formula developed by public health to figure this out. Okay, here's the formula, but that's kind of scary to look at. It's easy to look at it graphically. Here we have. So let's say we have 400 people, and this, by the way, this research was developed by the public health people to answer the question, what percent of lung cancer is due to cigarette smoking? So we look at 400 people, 300 are non-smokers, 100 are smokers. And those 300 non-smokers, 5% or 15 of them will get lung cancer for reasons other than cigarette smoke. Now look at cigarette smokers. Cigarette smoking about doubles the risk of lung cancer. So you look at over here, we have the 100 smokers, 5 of them will get lung cancer for reasons other than cigarette smoking, and 5 will get lung cancer because of cigarette smoking. So the percent of lung cancer due to cigarette smoking is this number here, this 5 here, divided by all 25, which means about 20%. We applied exactly the same formula for a wide range of toxins and environmental diseases, or chronic diseases. So here's our process. You have to determine the incidence of the disease in the unexposed population. Well, right there we ran into a problem because there's no unexposed population. So we had to end up comparing people with the highest exposure to those with the lowest exposure. Then we have to determine the threshold at which you start seeing increased risk. So and what makes this challenging is that while in general they tend to be linear, many of them are non-linear. So it gets very, very challenging. You have to kind of average things out as best you can. Then you want to determine what portion of the population is above the threshold for known increased risk, determine how much it increases the risk, and you put that into the formula and calculate the AF, or the attributable fraction.